So high cholesterol is one of the risk factors for heart disease. What are the others that people need to start paying attention to when they get their stats done or their lifestyle factors?
Yeah, certainly just really quickly on cholesterol, it is considered the most important risk factor. The prerequisite for building plaque in your coronary arteries is an LDL over 70. There's a really good article. You can just do a little Google search called "It's the Cholesterol Stupid." I didn't write the title, but it was an editorial in one of the biggest cardiology journals, which kind of explains the simple concepts as to why cholesterol is so important. And they pretty much conclude there is no evidence that if your LDL is under 70, LDL under 70, there's no evidence that smoking will clog your arteries, that being sedentary, obese, diabetic, or having high blood pressure will clog your arteries. So the prerequisite for clogging your arteries is having an LDL cholesterol over 70.
But smoking, just to be clear, smoking doesn't clog it. It makes them so they're not pliable. Isn't that right? And it damages them.
Hardens them, right?
There's two things you need really to build up plaque. You need the LDL over 70, and you need damage and inflammation to your arteries, right? And that's where the smoking comes in. It damages the arteries, it inflames the arteries. And so if you have a combination of LDL over 70 plus your arteries being inflamed and damaged, that's when you build up plaque. Now, of course, the number one thing that ends up damaging and inflaming the arteries is diet. Eating processed foods and high-fat animal-based foods is the worst thing to do. But other things like secondhand smoke and tobacco, it will damage and inflame the arteries. But other risk factors, we think about blood pressure. Normal blood pressure is less than 120 over 80. More than 50% of adult Americans, it's 70% of adult Americans over the age of 50. 70% of adult Americans over the age of 50 have high blood pressure. And a lot of that's because 80% or more of America is overweight now or obese. And those go hand in hand.
Now, why do they go hand in hand, though? It doesn't seem to really make sense. I thought high blood pressure came from the damage, the inflamed arteries or the arteries that were unable to flex properly.
Blood pressure is very complex. It's actually hormonal. There's a lot of endocrine system, adrenaline, and some kidney hormones that control blood pressure. It also has to do with arteries and veins and their flexibility, their compliance. There's even things that relate to brain, the brain that actually controls blood pressure quite a bit. So it is very complex. But one of the big things, the most common cause of difficult to control high blood pressure, where people need 3 or more medications, is something called sleep apnea, where people snore and stop breathing, which is markedly increased when people are overweight or obese because their neck gets really big and it blocks their airway. And so out of all lifestyle measures that can be done for somebody with high blood pressure, the one thing that has the most impact by far is weight loss. Weight loss is the most powerful thing to do to get your blood pressure under control. And part of that might be because sleep apnea improves significantly as you lose weight.
Okay.
Yeah. And other things, of course, other risk factors, diabetes, tobacco use. There is a genetic part of it, but like you hear for diabetes and high blood pressure and other things, the genes load the gun, but your diet and lifestyle pulls the trigger. Having a pure genetic heart disease where lifestyle means nothing is extraordinarily, I don't think I've ever seen it really. I mean, it's extraordinarily rare. I think one time as a medical student, I saw a 21-year-old need to have bypass surgery because he had a genetic high cholesterol and his LDL was 500. But that's not a common thing at all. So it's very rare that it's purely genetic.
Yeah. I want to ask you about endothelium. They beat that to death, I think, in the Game Changers. But it was really, it's really
so important.
It's so important. It's really powerful when you talk about food and antioxidants, right, and fiber-rich diet and how much those maintain a healthy endothelium. So for people that just need a refresher, that it is the membrane that lines the inside of the heart and blood vessels, and then endothelial cells release other things that are good for us and control things like blood clotting, and even our immune system. Where it doesn't seem like there's any evidence that would show that not having a healthy endothelium is okay or good for you. And it's pretty clear that eating a plant-based diet, like I just said, that's high in antioxidants and fiber, are extreme and other things, right? Exercise and rest, but we're talking about diet right now that are extremely important in maintaining this endothelial. Like you can't find anywhere that it says eggs help. I mean, they haven't even bothered to try to do that study because it's not going to fly.
Right.
How critical is this endothelial, and can we keep it healthy into our 80s and 90s? And how do we do that?
No, yeah, absolutely. It is very important. It is critical. Maybe LDL cholesterol is a little bit more important, but endothelial health is insanely important as well. So the thing is, when you think about the way I describe it to patients is you think about what might damage your endothelium and what might not. We know processed foods and animal-based foods, for the most part, they do cause endothelial injury, and they measure it by something called a brachial tourniquet test, where they actually inflate a blood pressure cuff on your arm for a very, very long time and use an ultrasound to see, after you release the pressure, how much does the artery dilate, and that kind of is a good idea, or a good measure of endothelial function. So they'll feed people different foods and different things and see what their endothelial function is, and it kind of helps guide us to figure out what's causing damage and what's not. So the important thing, though, is really what we look at to really get guidelines written and medical practice changed is what's going to actually impact the patient directly. How are we going to prevent a heart attack, prevent a stroke? And so the criticism of using the endothelium technique and thinking of it this way is, how can you prove to me that avoiding a certain substance that has been shown to cause damage to the endothelium is really going to prevent a heart attack or a stroke? It makes sense that it should, but one of the things that Dr. Esselstyn, for example, excludes from his diet is caffeine, because the brachial tourniquet test, when they did it, it showed caffeine causes endothelial dysfunction. Whereas there's not a lot of research. Actually, there's really no good solid evidence to say that caffeine increases heart attack and stroke risk, as long as you're not, drinking 10 pots of coffee a day and overdosing on it. And so it's super important from a conceptual perspective to understand why it is we recommend whole food plant-based, because in general, you're going to keep your endothelium from being damaged and inflamed. But it's not really the holy grail. It's not like the absolute most critical piece that we need to look at. It's important to understand the general concept. When you are, this is just for a healthy person who doesn't have coronary disease or vascular disease. Now, when you do have vascular disease, it is even more so important at that point, because now you're at a situation where you need to do everything you can to protect your endothelium, keep your LDL down, and protect your endothelium so it doesn't become inflamed, and you have you don't want a plaque to become unstable. And so in those instances, that's when Dr. Esselstyn will have you eat a ton of green leafy vegetables, the arugulas and the bok choy, the high nitrate containing foods, and he wants some balsamic vinegar on there to activate the nitrates. And by bathing your endothelium in this natural nitric oxide and allowing it to heal up, and eventually hopefully getting some degree of reversal, the outcomes make sense. In theory, will be improved. And there's a little data to show that, but of course, not enough for the medical community to really advocate it, to a large degree, but it makes common sense that would help. And so, and there's no harm in it, right? You're not going to hurt anything by doing that. So might as well give it a shot and keep your endothelium as healthy as you possibly can.
You just mentioned nitrates and then nitric oxide. I understand the nitric oxide a lot as an athlete and beets because I certainly feel
beet juice.
Yeah, it's really it really does improve the oxygenation. I feel like 5 to 10%. I mean that's just what it feels like. But nitrates are bad, right? That's what's in processed meat, like in hot dogs.
Oh yeah, so it's a little confusing. Yeah, so there's different type of nitrates. You want nitric oxide. Nitrates can be a precursor to nitric oxide, but nitrates themselves, when they're added to processed meats, they are carcinogenic.
Okay.
Yes. Okay. So it's a little bit different. Yes.
Okay. Thanks.
You want nitric oxide. So you want there's so many different types. But you want the ones that are going to turn into nitric oxide. Yeah. So thanks for clarifying that.
Yes. Okay. We don't want people to get a bunch of hot dogs with nitrates.
No. That's not good.
This is not the case. Fabulous.